Today we'll be learning about pressure ulcers. Do you know what pressure ulcers are? By the end of the video, you'll be able to identify what a pressure ulcer is, the different stages of pressure ulcers, different prevention strategies, signs and symptoms of a developing pressure ulcer, and risk factors.
Marai, the student nurse, arrives to the patient's home to conduct her initial home visit. The patient is 84 years old and lives at home with her daughter. She was diagnosed with osteoarthritis a few years ago and spends most of her day in bed.
Hi, my name is Marai Salina. I'm a nursing student from Florida International University and I'm here for an appointment. Yes, we've been.
The patient's daughter answers the door and invites the student nurse Marai into their home. Marai makes her way to the patient's room and introduces herself to the patient. She then begins her initial assessment.
The nursing student is here.
Hi, how are you?
Good, how are you?
Good, I'm Marai Salina. I'm the nursing student from FIU. I'm here for an appointment.
Nice to meet you. I'm Agnes. Was expecting you.
What you are witnessing is the nurse conducting her initial client assessment. She is collecting the patient's past medical history, past surgical history, drug allergies and sensitivities, medication regimen, health maintenance, personal and social history, alcohol, tobacco, drug screen, nutritional history, and patient and caregiver support system.
Because you're in bed a lot and you're not moving around so much, you're at high risk for developing something that we call pressure ulcers.
Oh no, what is that?
A pressure ulcer is an injury to the skin and the tissue underneath it caused by the pressure to the area. People who stay in bed or the chair most of the time are most likely to get pressure sores. Pressure sores can happen anywhere on your body. They are most common over a bony or firm area such as the hip, heel, elbow, ear, or the ankle. Pressure sores can also happen over pressure points on the back of the head, at the bottom of the spine, or the scapula. Even the weight of sheets and blankets can cause pressure sores on toes.
What causes pressure ulcers? Pressure on the skin can hurt the skin and the layers of the tissue underneath the area. When there is pressure on certain parts of the body, the tissue may not get enough blood. This may cause the tissue to become damaged and even die. Damage to the tissue and skin from pressure can begin after 1 or 2 hours of staying in one position.
Shearing, rubbing, or friction can also cause pressure ulcers. Shearing happens when the skin is dragged across a surface. For example, being moved up in a bed may cause skin shearing if the skin is pulled across the bed surface. A person may have friction on their skin, which is when the top layer of the skin is removed. This may cause the skin to turn red or feel like it is burning.
Wow, I really wouldn't want my mom getting anything like this. What are her chances of developing something like this?
Well, like I said, she's at very high risk for developing these pressure ulcers because she spends a lot of time in bed. However, there are a lot of things that we can still do to lower her risk. So let's go over everything together, okay?
Okay, that sounds good.
Perfect.
What are some risk factors for developing a pressure ulcer? Being an older adult or having had a pressure sore in the past, being unable to move, having a severe illness or circulation problems, having skin that is exposed to frequent wetness, having to stay in bed or in a chair, having a loss of feeling to part of the body, having confusion or decreased mental alertness.
The bony areas that are at high risk for developing pressure ulcers are the head, shoulders, sacrum, buttocks, and heels.
What are the stages of pressure ulcers? Stage 1. The skin is not broken, but the color of the skin changes. The skin may turn purple, red, or darker than normal. The redness of a stage 1 pressure sore is non-blanchable, which means the skin does not turn pale when you press on it. The skin may also feel firmer, warmer, or cooler than the skin around it. You may feel pain or itching in the area. At this stage, protecting the area from further pressure may treat the pressure sore. Stage 2. The top layer of the skin and the skin just below it are damaged. The skin may be broken, have a blister or cave inward. Stage 3. The damage to the skin has gone all the way into the fatty layer and looks like a deep crater. The crater under the skin may be wider than the hole you see at the top of the skin. Stage 4. The pressure sore is a very deep wound that goes all the way down into the muscle or into the bone.
There are different things you can do to prevent yourself from getting a pressure ulcer. Check your skin several times a day. Keep your skin dry. Keep your skin clean. Change positions frequently. Protect the skin over bony areas. Other tips for protecting your skin while in bed. Keep the bottom sheet of the bed free of wrinkles. Make sure there are no hard items in the bed. Avoid clothing that has buttons, zippers, or thick seams that could put pressure on your skin. Ask your caregiver for more information about exercises that you can do in bed. If you are at high risk of getting pressure sores, do not sit in a chair for longer than 2 hours at a time. Do not massage the skin over bony areas.
Okay, after going through your fridge, I was able to find great items that you can include in your mom's diet, and it's going to help in preventing the risk for her forming a pressure ulcer. There's 3 things that you need to remember. She needs to drink a lot of liquids. Sources of liquids for her that are healthy are going to be water. She can have milk. She can have juices. Another thing that she needs to have in her diet, and it's very important, is going to be proteins. Sources of proteins, you have great sources of proteins in your fridge. One of them is the chicken, the poultry. One of them is the fish. And you also have nuts. That's great sources for her of proteins. The other thing that you need to include in her diet are going to be dairy products. Dairy products include anything that is, you can get it from milk or from yogurt. If you include this in your mom's diet, I assure you that it's going to decrease the risk for her of forming a pressure ulcer.
Okay, thank you so much for showing me this. Now I know what to give my mom to help her so she won't develop this.
It's a pleasure.
Okay.
Thanks.
When should you call a caregiver? If you have any signs of skin damage like a bony area that feels firmer, warmer, or colder than the skin around it, calluses, cracked skin or dry areas, skin that caves inward, begins to swell or has a blister, skin that has a new shiny appearance, skin color changes such as areas of redness, purple, or blue areas. These areas may be harder to find on a dark-skinned individuals, so look at common sites carefully. Preventing pressure sores is very important. Pressure sores can be hard to heal once they start. They can cause pain and discomfort. If a pressure sore gets bad, you may need to stay in the hospital. You may get a bad infection because of your pressure sore. A pressure sore can take weeks to months to heal, or it may not heal at all. A pressure sore can be very serious and even life-threatening.
Wow, I feel like I've learned so much today.
Well, now that you have learned so much, can you tell me some things that you remember about what we spoke about today?
Yes, I learned what a pressure ulcer is, how to prevent it, the different stages of pressure ulcers, what to do, like what to eat, nutrition to better, to prevent the pressure ulcer, and when to call my doctor if, one develops.
That's great. I think we have made great progress with today's visit. Do you guys have any more questions for me?
No, thank you.
Nurse Marai makes notes about the progress of their visit and the teaching provided and bids them goodbye.
Thank you
Nice
so
to
much for
meet
having me
you.
over.